Hello, Miss Strickland. Hey. I'm going to be performing a head-to-toe assessment on you today, just to check up on all your body systems and make sure everything looks okay. Okay? So to start with, I'm going to look at your skin. I'm going to be looking at the color, the texture. I'm going to look at your turgor, make sure you're good and hydrated. I'm going to check the temperature, and everything looks good to me. I'm going to check your nails. I'm going to check them for color, shape. I'm going to see if they have any lesions, check for capillary fill, which should be under 3 seconds. I'm going to get you to perform the shamrock test. You put your fingers just like this. This is going to make sure that your angle on your nails is less than 160 degrees. It checks for clubbing, so if you did have clubbing, which you don't, if you did, then you would have some kind of respiratory problem. That can be an indicator sometimes. Alright, so we've checked your skin and your nails. Now I'm going to look at your face. I'm just going to look at it and make sure your eyebrows, eyes, nose, mouth, ears, everything's symmetrical and centered in your face. I'm going to look at your hair. I'm going to look at the color, the texture, the luster. I'm going to look for it to be evenly distributed. Any absence or excess, and then everything looks fine. Now I'm going to kind of sift through your hair and look at your scalp. Make sure I don't see any kind of lesions in the scalp. And everything is looking good. Okay. Now I'm going to palpate your scalp. I want you to tell me if you feel any kind of tenderness or anything like that, okay? Everything feel good? Okay. So now that that's finished, I'm going to come back to your face. I'm going to get you to smile for me, frown, puff out your cheeks. Okay. Those 3 tests are going to test cranial nerve 7, which is facial nerve. Next, I'm going to get you to clench your teeth for me. I'm going to feel your T and J. That's going to test cranial nerve 5, which is trigeminal. I'm going to get you to close your eyes. I'm going to perform a test that's called soft touch. This is also going to test cranial nerve 5, trigeminal. So when this touches your face, I just want you to say yes. Okay? So now that we've done that, I'm going to inspect your neck. I'm going to look at your trachea. I'm going to make sure that it is in fact centered in the middle of your neck. I'm going to palpate. Make sure I don't feel any lumps or anything like that. I'm going to give you this water, and I'm just going to watch you swallow. So I want you to take a swallow of the water and kind of tilt your head back so I can see you swallow. Okay, everything looks good. Alright, that's going to check our vagus nerve. Now I am going to go to the back behind you, and I'm going to palpate and feel for the thyroid. So what I'm going to do is I'm going to give you this water again, and hang on. Okay, what I want you to do is I want you to get a sip of water and hold it in your mouth. Okay, I want you to look down and to the left, and then go ahead and swallow. Okay, now do the same thing, but look to the right. Okay, go ahead and swallow. Okay, I didn't feel anything, which I shouldn't be able to. So your thyroid's good. Now what I'm going to do is I'm going to palpate your carotid arteries. I'm going to do this one at a time so that you do not pass out. And I'm going to also palpate your temporal arteries. Okay, and then now I'm going to auscultate those. I'm going to auscultate your thyroid, carotid, and temporal arteries just to make sure that I don't hear any kind of murmurs or bruits. I'm going to do this with the bell of the stethoscope. Alright, everything sounds good. Okay, Now I'm going to test your neck muscles, and I'm going to put my hand against your face, and I just want you to push against some resistance, okay? So push against my hand, forward, backwards, okay? Now I want you to shrug your shoulders, okay? And that is going to test cranial nerve 11, which is our accessory nerve. Okay, now I'm going to go to the head, back to the head. First, I'm going to look at your ears. I'm going to make sure that they are even on both sides, and they are. I'm going to inspect the outside of the ear. I'm going to inspect the tragus and the middle of the ear right here. And then I'm going to get my otoscope. Okay. I'm going to get you to put your head to the side. I'm going to pull the ear up and back. And up and back. Insert and look. And I see a pearly gray color. So same thing with this side. Up and back. And it's a pearly gray. Okay, after I have inspected the ears, everything looks good, so I'm going to move to the face. I'm going to palpate the face. Tell me if you feel any kind of tenderness. I'm going to palpate the frontal and maxillary sinuses. If you were to have a sinus infection or anything like that, then there would be pain upon palpation of those. Anything? Okay. Now I'm going to look at your nose. I'm going to grab a pair of gloves real quick. Okay, so I'm going to look at your nose. And to begin with, I'm going to look at the outer campus of the nose. I'm going to palpate it and make sure that there aren't any lesions, bumps, or anything, any tenderness. Feel anything? Okay. I'm going to get my pen line, and I'm going to look inside of the nose. I'm going to check for a deviated septum, make sure that everything looks good and clear. Okay, and it does. Now I'm going to check the patency of the nares. So I'm going to occlude one side, and I want you to breathe in. Okay, I'm going to do the same with the other. Okay. Now we're going to perform a smell test. This is going to test nerve number 1, which is your olfactory nerve. So I'm going to give you something to smell on each side, just like what I did. I'm going to occlude one side, give you something to smell. And I want you to close your eyes and tell me what it is that you smell. Okay? So go ahead and close your eyes. Okay? Yes? All right. Yes. Okay. Once we've inspected the nose, everything looks good. So now I'm going to go to the mouth. First, I'm going to look at your mouth. I'm going to make sure that your lips are symmetrical and they are kind of in the center of your face. I'm going to look at their color. They are a nice pink color. I'm going to palpate the lips just to make sure I don't feel any lumps or lesions. And everything looks good. So I'm going to get my pen light, and I'm going to use a tongue blade to inspect the inside of your mouth. Okay, I'm going to get you to open your mouth for me. Alright, I'm going to be looking at the gums. They are a nice moist pink color. I'm checking the teeth to make sure that all of them are in fact intact. I'm going to check up top for the stents and ducts, and down here under the tongue for the wart and ducts. I'm going to look at the tongue itself, and it is a bright pink color, so that's good. I'm going to get you to say ah for me. Okay, I'm checking the rise and fall of the uvula. That's going to check our nerve 12, hypoglossal. So now that I've inspected the mouth, we're going to do a taste test. So what I'm going to do is, just like with the smell test, I'm going to put a few things on some little cotton swabs, and I want you to close your mouth, and I want you to tell me where you taste what, okay? So go ahead and close your mouth. Close your eyes. Yes. Okay. Yes. Yes. All right, that's the smell test. So that's going to also check our cranial nerve 12, hypoglossal, and also our vagus nerve. Okay. So now that we see that your nose and mouth looks good, your ears look good, I'm going to look at your eyes. First, I'm just going to look at the front of them again, make sure that your eyebrows and eyes are symmetrical. Look at your eyelids. I'm going to make sure you do have eyelashes on both eyes and even the mouth. I'm going to look at the sides, make sure that they are clear, free from any kind of debris. All right. I'm going to check for perla, so I'm going to make sure that your pupils are equal, which they are. They're round. I'm about to check if they're reactive to light, so just look at me. Okay, both are equally reactive to light, and then I'm going to check for accommodation. So I want you to look at this pen light and then look at something behind me. Pen light behind me. Okay, and they do evenly accommodate. So now I'm going to do a few tests. I'm going to look at your conjunctiva first. It is a nice pink moist color, so that's good. I'm going to do some tests now. They're going to check cranial nerves 3, 4, and 6. These are going to be your oculomotor, trochlear, and abducens nerves. So the first one that I'm going to do is going to be a direct and consensual. I'm going to put my hand on the bridge of your nose, and I'm going to shine the light into one of your eyes. And when your cornea constricts on this side that the light shine in, it should also constrict on the other. Okay? All right? Okay, the next thing that I'm going to do is the H test. So I'm going to get you to follow my pen light in the shape of an H. Okay, perfect. And now we're going to check for your peripheral vision. So I want you to cover an eye. Okay. Now I'm going to move my hand. I want you to tell me right when you see it. Okay. Okay. Now. Okay. Cover your other eye. And we're going to do the same thing. Okay. Okay. Now, these next few tests that I'm going to do are going to check your optic nerve, number 2. I'm going to do a corneal light reflex. What this does, I'm going to shine my light right here in the middle of the bridge of your nose, and I should see a twinkle in your eye at the same spot in both eyes. Okay? And I do. We're going to do a cover and uncover test, so I want you to cover one of your eyes with this. I want you to focus on my finger. Alright, now uncover. Alright, now cover your other eye. Focus on my finger. Now uncover. Okay, what this does is check for lazy eye. If you were to have lazy eye, then the eye that you uncovered would kind of drift over to the side. The next test that I'm going to perform is the Rosenbaum test. I'm going to get you to read to me the first line on this paper.
NG to intermittent suction.
Okay. And we had also assessed the Snellen test before we came in here, so that's going to check for your eyesight too. The next thing that I'm going to do is, I'm going to do a few tests to check for your balance. So I want you to stand up for me. This is called the Romberg test. I want you to close your eyes and just stand here for a second. This is going to test your balance. Okay, and it's good. So there's a positive Romberg. Then I'm going to do a test that I call the Weber test, and this is going to test bone conduction. So what I'm going to do is I'm going to strike this against my hand, put it on the top of your head, and I want you to tell me if you feel it in both ears or one or the other, okay? Both? Okay. The next test I'm going to do is the Renee test. This one's going to test bone and air conduction. So what I'm going to do is I'm going to strike it against my hand again. I'm going to put it back here on your mastoid process. When you quit feeling it, let me know because I'm going to put it in front of your ear where we can listen to the air conduction, okay? And the air conduction should be twice as long as the bone conduction. Okay, it was 9 and 18. So we're going to test your other one. Same thing. Okay, it was 10 and 20. Alright, so now that those are done, I'm going to now that I've finished your head and all your cranial nerves and everything, I'm going to move down to your thorax. So, first off, I'm just going to ask you to take your shirt off. Okay. Now I'm just going to inspect. I'm going to make sure that it's 2-to-1 ratio. So we've got 2 going across to 1 right here at the side. I'm going to make sure that everything looks symmetrical, that I don't see any kind of thrills or any kind of palpitations on the chest that are abnormal. And then I'm also going to go around to the back and inspect the back to make sure the same with the back and everything looks good and symmetrical. I'm going to go ahead and name out the breath sounds that I'm going to be listening for. They're going to be tracheal, bronchial, bronchobasicular, and the rest is vesicular. And same thing on the back, except with the back we're not going to have any tracheal, so it's going to be bronchial, bronchobasicular, and vesicular. Okay, so before I listen to any kind of breath sounds, I'm going to go ahead and palpate. So I'm going to go back around to the back. I'm going to palpate thorax, making sure to not feel any kind of lumps or lesions. Okay? And then I'm going to percuss. Okay? And once I've percussed, I'm going to go ahead and auscultate for breath sounds. When I touch the stethoscope to you, I'm just going to ask you to take a deep breath. Okay. There's clear lung sounds. While I'm back here, I'm going to check for tactile thermitis. So when you feel my hand touch your back, I want you to say 99. Then the next thing I'm going to check for is symmetrical expansion. So I'm going to pinch up a little bit of skin right here between, like right where the spine, the middle of the back, and I want you to take a deep breath in and out. And just like its name, it is checking for symmetry upon expanding the lungs, making sure that they are even and equal when expanding. So, now that I have inspected the thorax, I'm going to move to the heart. And so with the heart, I'm going to first just inspect the chest cavity. I'm going to make sure again that everything is symmetric and that I don't see any kind of lumps or anything like that. I'm going to palpate to make sure that I don't feel anything abnormal, and I don't. The next thing I'm going to do is I'm going to mark our different valves that we're going to be listening to. So I'll go ahead and do those. The first one is going to be our aortic valve. It's going to be the second intercostal space, right sternal border. So we're going to go. Okay. The second one is going to be the pulmonic valve. That's going to be the second intercostal space, left sternal border. So we're going to pop it down. Right here. The third is going to be Erb's point, and that's going to be the third intercostal space, left sternal border. The fourth is the tricuspid valve. That's going to be the fifth, fourth. The tricuspid valve is the fourth intercostal space, left sternal border. And then the last one is going to be the mitral valve, and that is going to be midline on the left sternal border. So, fifth intercostal space. Okay. So once I have all those marked, I'm going to palpate again over those to make sure that I don't feel any kind of thrills or anything like that. Okay, and then I'm going to auscultate over these, and when I do, I'm going to auscultate with the diaphragm and the bell of my stethoscope. The bell is going to help me determine if there's any murmurs or bruise. Everything sounds good. While I've got you here, I'm going to go ahead and point out all your different pulses that I could get. First off would be your temporal pulses, which we did get earlier in the when we were examining the head. Then we have your carotid, and when you palpate these, you want to make sure to do them one at a time so that you don't fall out. Okay. After that, we have your brachial. So see your arm. It's going to be right here. On this one, brachial. Okay, then we've got your radial. Radial. Then we have your popliteal that you can get behind the knee. And then we've got your dorsalis pedis on top of the foot. And your posterior tibialis behind the foot back here. And you should be able to feel a pulse in all these areas, which I do. Okay. Now that that's covered, we've done your thorax, your heart, your pulses. So now we're going to move to your abdomen. So I'm going to get you to lay back for me. Okay, first I'm just going to get eye level with the stomach. I'm just going to kind of watch her breathe. I'm going to look for any kind of peristalsis, which she is pretty small, so I'll be able to kind of see a lot of that going on. Then once I see that everything's okay there, I'm going to divide the stomach into 4 quadrants. I'm going to go straight down the umbilicus and then straight across. It's going to be my right upper, right lower, and left lower quadrants. Once I have divided those, I'm going to listen for vowel sounds in each quadrant. And she does have active vowel sounds in each quadrant. So next I'm going to percuss the stomach, and I'm going to also percuss for the liver border after that. So I'll just do the whole stomach first. Okay, now I'm going to percuss for the liver border. So what I'm going to do is I'm going to draw a line straight down from the umbilicus. I'm going to work my way up until I hear a sound change. Next, I'm going to go down from the 4th intercostal space, same thing until I hear a sound. Okay, and the liver border should be between 2 and 6 inches. So I'm going to 2 and 4 inches. So I'm going to measure now. And hers is exactly at about 2. So we're good there. The next thing I'm going to do is palpate the stomach. I'm going to start with light palpations and then move to deeper palpations. So tell me if you feel any kind of tenderness or anything while I'm doing these, okay? Good. Now we're going to go to a little bit deeper palpations. Still good? Okay. Now I'm going to palpate for the liver and the spleen. I shouldn't be able to feel either one of these unless they're inflamed or have any kind of growth or anything like that. So I'm going to put my hand underneath you right here. I'm going to ask you to inhale and go ahead and exhale. Okay. Then I'm going to palpate for the spleen over here. Same thing. Inhale, exhale. Okay. And I didn't feel anything, so that's good. Now, that's pretty much it for the abdomen. So I'm going to get you to sit up for me. And now I'm going to do some different sensory tests for you. I'm going to do what we call soft touch, and I'm also going to do sharp and dull. So I want you to shut your eyes, and I want you to tell me when you feel the cotton ball. Okay? Now this is the sharp dull test, so I'm going to show you dull, and then I'll show you sharp. So when you feel this, I want you to tell me whether it's sharp or dull. Okay? Then I'm going to perform 3 other sensory kind of neuro tests on you. The first one is going to be stereognosis. And what I'm going to do is I'm going to place an object in your hand. I want you to close your eyes and I want you to tell me exactly what it is up in your hand, okay? So shut your eyes. Okay, give me your hand. Okay. Close your eyes. Other hand. Okay. Now I'm going to perform graphesthesia, and what I'm going to do with this one is I'm going to get you to close your eyes. I'm going to write a letter in one hand and a number in the other, and I want you to tell me what it is, okay?
A.
Okay. Okay. And then the last one that I'm going to perform is kinesthesia, and this time I want you to close your eyes, and I'm going to move a different part of your body. I want you to tell me exactly what it is that I'm moving, okay?
On. This.
Okay. So now that those sensory tests are over, I'm going to make sure that you are alert and oriented times 3. So I want you to tell me what your name is.
Danielle.
Where are you?
Nursing lab.
Okay, and then what day is it?
Thursday.
Okay. Now I'm going to test your memory. I'm going to test your past memory, your present, and your past, present, and past, present, and recent memory. So I'm gonna ask you your past memory first. When's your birthday again?
April 12th, 1994.
Okay. Let me see. Let's see. We're gonna test your present memory. So, who's the president of the United States?
Obama.
Okay. And then lastly, we'll test your recent memory. So what I'm going to do is I'm going to give you 3 words, and the 3 words that I give you, I'm going to want you to remember, and then I'm going to ask you later on in the exam what they were. Okay? So dog, cat, fish.
Dog, cat, fish.
Okay. So remember those, and I'll ask you those later on. Okay. So next, I'm going to look at your musculoskeletal system. I'm going to look at your joints and everything like that and make sure that everything is working properly. So I'm going to inspect your shoulders, palpate them, inspect and palpate your elbows, inspect and palpate your wrists, fingers, your knees, your ankles, and your feet. Yeah, they are cold. So everything looks good. Then I'm going to check your reflexes. So I'm going to get you to just sit like you are. First, I'm going to check your, first I'm going to start at the bottom. So I want you to get on the bed, kind of on your knees like this, right here, and I'm going to check the reflexes of your feet, your Achilles back here, okay? So, we go. Okay, and you do have present reflexes in both the left and right, so you can sit back down. Next, I'm going to do your patellar reflexes. Okay, present in both. Now, I'm going to do your brachial reflexes. So just hang. Okay, and then on this side, relax. Okay, now I'm going to check your radial reflexes. So just relax this. Okay. Okay, and then oh, gotta check your reflexes here too. So I want you to relax your arm on top of my arm. There you go. Okay. Same thing with this, just relax it on my arm. Okay. So reflexes were present on both sides in every area, so that was good. Now I'm going to get you to do some range of motion exercises. So I want you to put your arms out to the side, up, cross, stop here, bring them back down, cross in front. Okay. Then I want you to bring your legs up one at a time. Okay. Now we're going to test your strength for upper and lower. So I want you to hold your arms like this, and I want you to pull towards you, push towards me. Okay. Same thing for your legs. Pull towards you, and push towards me. Now I am going to do some more neurological testing. So this is going to assess, we've already assessed your gait when you walked in. We did the Romberg test, so we know that you do have good balance. So the last test for that area, I want you to stand up for me. And I want you to walk that way. I want you to walk heel to toe. Okay, turn around. Okay, that's good. So we know that you've got good balance. Those 3 tests are going to help to, plus the Weber and the Renee tests are all dealing with your vestibular cochlear nerve. Oh, what were those 3 words that I asked you earlier?
Dog, catfish.
Okay, and then let's see here. Okay, I'm going to review the cranial nerves that I have checked. So first is going to be olfactory. We check that with the smell test. Next is going to be optic, and we test that with our different visual field tests. The next 3 were all together, so that was oculomotor, trochlear, and abducens. And we also check those with the smelling and with the H test, periphery test. Then we had your trigeminal. We checked that when you clenched your jaws. Abducens. We checked abducens. Okay, we'll come back to that. But facial, we checked with you smiling and frowning. Vestibular cochlear, we did with the Romberg, Weber, and Renee test. Glossopharyngeal, we did with when I watched you swallow. Let's see. Vagus nerve, we did. That had something that was done with your taste test also, and with you swallowing. Accessory, we did when you shrugged your shoulders, and then hypoglossal, we did with your tongue. So when you stuck out your tongue, and when we did your taste test too, that had to do with your hypoglossal as well. So I'm going to take a second. I'm going to look at my note card to see all the things that I missed, and then I'll finish off. I missed a couple things with your cerebellar functioning. We did the Romberg test, we did the Gait, and then we did the walking heel to toe. But I need to check an upper and a lower as well. So I want you to, we're going to do supination and pronation. So put your hands on your lap like this and flip them over, and then do them faster, faster. Okay? And then for the lower extremities, I'm going to get you to draw a figure 8 with each one of your feet. Okay? Okay. And then when I was doing the abdomen, I forgot to explain where the different valves were in the stomach. So I'm going to get you to lay back. Okay. When we're looking at the stomach, we have 6 different valves that we can palpate and auscultate. So first is going to be your aortic, then you're going to have your renal, iliac, and then femoral. When I auscultate these and palpate these, I would normally do femoral, but we're not going to do that today. So I'm just going to go ahead and auscultate over those. Okay, and then I'm going to listen to make sure that I don't hear any kind of bruise or murmurs. Okay, so everything sounds good. You can sit back up now. And I guess that is it for my exam. Everything looked really good, so that's